Hello everyone, I'm Dr. Tanmay Bhandari and I scored an All India rank of 817 in this year's NEET-PG, and in this video I'm going to be talking about selecting my dream branch, and actually the branch reveal will be at the end, so stick around till the end because the story is more interesting than my choice. So let me begin. Let me start from my MBBS days. So in my MBBS days, I was, a really enthusiastic student. I like to explore, I like to talk to people, and I did not know what branch I wanted to pick, but I would always, think about what branch I want, but I was never really sure. Like people know from the beginning that they want to be surgeons, they want to be a cardiologist, they want to be a neurosurgeon, but I didn't want any of that. And deep down in my MBBS days, I had started hating this entire field of being a doctor and the entire, field, because I felt like I didn't belong here. It was a lot of study, it was a lot of hustle. You had to study a lot, you had to work a lot, and like I started losing interest in actually doing PG. But eventually, when internship started, things started changing around because I saw the kind of impact this profession has and the kind of job satisfaction this profession has. And as you know, I kept progressing in my journey in this medical field, like as a med student and as an intern. I had the opportunity to look at specialties closely, speak to a lot of residents, speak to a lot of doctors as to how their life is in residency, also like 10, 20, 30 years after residency, and to get an idea. But I never really had an idea. So one thing that used to really motivate me, and one thing that I wanted to do during my internship was derma, because a, the money is good, b, it's like a 9 to 5 job, no emergencies, so no actual, what do you say, like it's a good and a bad side, because a, there's no adrenaline rush, but b, it's like a very safe branch, and you can actually do other things with it. It's not like a heavy commitment, high emotion, high tension branch. So I really, and it has a really high cutoff. So I studied thinking that I wanted to do derma, but I, convinced myself at the back of my head that, even if I don't get a good rank, I'll pick anything clinical. And I have seen my seniors making different choices. Like one of my seniors, like she picked ophtha, even at a 370 rank. Like she's the first person in India who picked up ophtha. So like I even have a video with her, like Shishti. So like there's a lot of you know uh, things that you need to consider when you pick a branch. So anyway, I studied thinking that if I don't have any idea, and if I was held at gunpoint at this point of time, I will pick derma. So fast forward to NEET-PG results. Like NEET-PG results came, and I was even before NEET-PG results, actually INI-CET results came, and like my rank was 1.9 thousand, and at this rank, like I was very close to getting family medicine, and I still, opted to get family medicine, and I even got physical medicine and rehabilitation. So I was fine with any branch as long as it was clinical, and I knew that NEET PG was coming around. There are more seats in NEET PG than INI-CET. In INI-CET, if you need a very good clinical branch in a very good institute, you need to be under top 400 All India rank. So like that's dicey, but in NEET PG, if you have a top 1,000 rank, you can pick any branch you want. Even if you don't get your desired institute, you will definitely get it in peripheral institutes. So like after my NEET PG, like uh, it was very difficult to pick a branch, and my direct interest towards derma, I started questioning that as well. So I just told myself like it's very difficult to pinpoint and say that this is the branch for you. Instead, what I did was that I started ruling out branches. So initially, right off the back of my head, like I ruled out all the first and second year subjects like anatomy, physiology, biochemistry, pathology, micro, pharma. Like pharma is good because like it gives you like a corporate job where you can work with big pharma companies. Patho is good in the sense like it has an entrepreneurial side to it, and there is oncopath and a lot of interesting things that you can do with patho. Micro is growing because like the antimicrobial resistance and the entire antimicrobial situation is escalating, and good hospitals want good microbiologists. So all of these jobs are there, but they are non-clinical branches. So again, like I removed them from my consideration. With non-clinical branches, I also ruled out radio and any imaging related branch because I really wanted to be the primary person who was in charge of my patient care instead of, being and having a very passive role in patient care. That is why I ruled out radiology also. But in I've considered radiology so many times because a lot of people ask me to consider radio because of my rank, because it has an amazing work-life balance. The possibilities with AI are amplified because like you can work with AI, you can, in this particular time, you are growing and AI is growing. So you can literally help build AI, which is an amazing thing. You can have your own practice, even though it's investment heavy, but you can have your own practice. One thing that I did not like with radio, and a lot of people don't even know this, is that radiology is a very dependent branch. Like you're dependent on other doctors to give you work, you're dependent on big corporates to give you a job, and sometimes there's a lot of malpractice happening there. Like you have to give cuts to other doctors for referring patients to you. For example, if a CT scan costs 1,000 rupees, like you have to give 40 to 50% of that money to the doctor who referred the patient to you. So that thing really, made me eliminate all of these non-clinical branches. So straight up eliminating all of these non-clinical branches. Now let's move on to clinical branches. Then comes ENT. I was really never interested in ENT, so I ruled ENT out pretty easily. Although ENT, like this is a video where I can talk about my perspective on other branches, because ENT is a very OT heavy field, and it gives you an opportunity to do whatever you want. Like you can hyper specialize in one thing, or you can have an OPD kind of setup, or you can operate on a variety of things, and it's a very satisfying branch as well, because restoring someone's special senses is always very rewarding. But I did not ever like ENT and I struggled with ENT in my NEET PG preparation as well. So I eliminated ENT. Ophtha is another branch that I would think, then I would leave, then I would think, then someone else would tell me something, then I would think about it again. Because think about, like cataract, like there are not a lot of ophthalmologists in this country, and every single human being in this country will require cataract surgeries at some point in their life, and a lot of other things are being developing. Ophthal is a very technology dependent branch, and the technology is evolving rapidly. And with that, like that thrill of something new coming up every single day in your branch, I love that thing. The only downside to Ophthal is that if you want your own setup, you need to invest crores, because the phaco machines and all of that really are expensive. But again, like you charge like upwards of 50,000 per cataract surgery. The surgery is very small, probably max to max 5 minutes long, and after that, what do you say, like it's a very 9 to 5 kind of job. There are not a lot of emergencies in that branch. Even though there are emergencies, you can easily choose to not attend emergencies, and you can choose that kind of a work profile. It is a very entrepreneurship dependent field, because you see people putting out huge eye centers all over the country, and it's a very good opportunity to do business and things like that. And one more thing that I realized was that Oftha is a very rewarding branch, because you're literally restoring someone's eyesight. Like someone can see because of you. It's a very high job satisfaction kind of a branch. So I thought about it, then I didn't, because I still remember in an internship, like I had this globe injury patient, and I just I would just tell my co-intern, please attend to this patient because I cannot, like, it feels very unnatural to me to tend to anything related to eye. Like, I can handle feces, urine, blood, anything that you want, but I'm really, not comfortable with handling the eye. I think that would have come with practice, but again, when it comes to interest, particularly, I ruled that branch out, even though I didn't have a reason to, because probably like it was my gut that told me to rule out that branch, because I literally think Oftha is a perfect branch, and especially for mid rankers, if you want a high paying branch, Oftha is the thing for you, because you can literally do 20 to 30 surgeries a day and earn in lakhs per month. Anyway, if you guys want me, I can literally have every single specialist on this podcast and have conversations with them. Other than that, let's talk about PSM. PSM, again, it's a non-clinical branch, so I eliminated it, although it has a lot of other things as well. And now coming to anesthesia, I didn't want, like, again saying, like, I wanted to play a primary role in patient care, not a secondary role, so I eliminated it. Although anesthesia sounds very enticing, like, you can choose your work hours, you can choose how you want to work and your work conditions and work terms, and you earn like 5 to 10,000 per case, and you can easily do multiple cases every day. You can freelance, you can have an academic post, you can do a lot with anesthesia, but again, I didn't think it was for me. Now, coming to psychiatry, I love psychiatry, but uh, I don't think I want to be involved where a lot of mental health related stuff is involved. Um, Although I love psychiatry as a subject, I love how rewarding of a branch it is. Both psychiatry and neurology, anything related to the human brain always, like, makes me really curious, but I don't think I even want to go to that area where I need to think about whether this thing about my patient is actually affecting me. And if, and in psychiatry, and when it comes to therapy, there's no right or wrong. So, like, there is no, guidelines or demarcation. There's a lot of gray things in psychiatry. So again, I love psychiatry, but I did not really think of psychiatry because of the fact that I was scared that it would affect me. Now, let's come to the branches that I actively ruled in. So then I came up to four branches. One was medicine. Oh, I ruled out surgery because to be a oh yeah, to rule out surgery is a big thing, because after being a general surgeon, you need to do some kind of fellowship that is universal in all fields, I guess. But like, surgery requires a lot of dedication. Surgery residency is not easy. Like, surgery is an extremely rewarding field, but it has like a very, skewed reward rate. Like, there are 90% surgeons who are just normal, and then there are 10% surgeons who do 90% of the work and make 90% of the money that is there in surgery. And it makes your name, like, you will be known throughout the country if you are good at a particular surgery. But it is a skill, it takes time to master. And like, first you have to learn general surgery. The best thing about ENT and ophtha is already you're going in a specialized field. First you have to learn general surgery, which is a very difficult residency. And somehow, like, I don't know, like, I had self doubt about myself that will I be good enough to, uh, be able to learn these things properly or understand and study these things properly. So anyway, it was very difficult to rule surgery out, but somehow I did it, and going with the herd and just going with my gut feeling, I didn't think surgery was for me. Even though I would have got surgery at a very great institute, I even at one point of time I thought about like a 6 year neurosurgery course, but again I decided against it because I don't know, like, I spoke to a few surgery residents as well, but I don't know. I just could not. you know, like push myself to pick surgery. And I thought that if I wanted to pick a surgical branch, ortho or OBGY would be my better bets than surgery. So then I was able to, like, go to the top four. Like, I ruled out everything else, and then I got my top four. It was medicine, and I ruled out pediatrics because pediatrics, again, you have to deal with children. It is a very emotional, it is more of a counseling branch than a treating branch, because you're dealing with kids. Like in medicine, 90% of the times you're dealing with the geriatric age group, which is above like 70, 80 years old. So, like, a life of a child is always more valuable than a life of a 90-year-old. There's a lot of emotions involved. Parents are panicky, children cry, and I don't particularly think that branch interests me. And I don't know, I just decided to not pick that branch per se. Although it is an amazing and a very, very, very rewarding branch, both financially and like emotionally. Like, you are literally giving someone 90 plus years of life by saving their life is amazing. And like, getting a child from extremely sick to this is next level. Plus, like, children really don't ever do anything to harm their life, but things happen to them naturally. So it's a very emotionally demanding branch per se. But I just had an intuition again that I did not want to do pediatrics. It was just not cut out for me. Now, coming to my top four, it was medicine, or derma, ortho, or OBGY. And for those who don't know, and most of you don't know this, but I was born with CTEV, which is club foot, and I have undergone post PMSTR procedure, which is posterior medial soft tissue release. And for that reason, like, I can't stand for long hours. I felt like it would have like a long-term impact on me. Even though I can stand for long hours, I walk normally, but it puts some pressure on my hips, on my legs. And I thought if I was going to pick a long-term OT related job, I would be doing a lot of damage to my body. But that was just one part of it, because like 90% of my CTV is corrected now. But still, like, there's some parts that remain. And like, I just thought that I was not inclined towards surgical branches. And as the trend goes, like, toppers usually don't pick surgical branches. Like, one of my friends at 600 rank, he has picked ortho. In my internship, I loved ortho. I love doing sports medicine. I love spine, I love knee, I love hip, like, I love shoulder, like all aspects of ortho I love. And the entire um but the entire ortho guy personality really entices me. The same as with OBGY. You can do fetal medicine, you can do gynae oncology, you can do laparoscopic surgery, you can do so much with OBGY. And both of these branches don't really need SS. Like, that's the best part about these branches, because like, you need to do fellowships, but there's no dedicated NEET super specialty exam. I really wanted to get out of this race, and I really wanted to stop stacking degrees and do actual work, real work in real life. Other More importantly, I didn't want to chase the next degree. I didn't want to feel inadequate about my own degree. Like, there are BAMS, BHMS people who are literally working on a single degree with no knowledge, with no confidence, and still they start their practices early. So I really didn't want to, chase academic qualifications. So that's why I didn't choose general surgery. There's another reason for that. And again, if I would choose medicine, there is like, like, surgery has, like, in these days, like, if you pick general surgery, you have to do an SS. But in medicine, it's kind of not the case, because you can really do general medicine. And I recently heard from someone that in the past 6 to 7 years, the trend of doing a super specialty has gone so up that actually there is a need for good physicians these days. So another thing, like, I just ruled these branches out because I thought I have a good rank, so I should maybe go with medicine and derma. And again, I thought about derma a lot, but one thing that really, you know made me rule out derma is because I got a good rank and I don't want to waste it on being someone's beauty parlor doctor. I spoke to a senior of mine who had got all India rank 30, and she had got derma at PGI Chandigarh. She is doing derma, and it's an extremely, versatile branch again, because you can literally pick what kind of practice you want. If you want to practice clinical dermatology, if you want to do dermatopathology, if you want to do cosmetology, you can pick anything and everything. But I wanted to be useful to the society, to the people around me, like my friends, my family, and my extended family, and in general people. I just wanted to be someone who, people can easily rely on in difficult times, and derma would not give me that status in society. And second thing is that even though derma has good money, then the entire thing about becoming a doctor and actually doing something meaningful, and derma is meaningful, I would say. But dealing with life, curing people who are admitted in the ICU on their deathbeds and seeing them recover was more satisfying for me. So in the end, I ended up picking medicine. And again, the next dilemma that was in my head was whether I want to take MD or DNB medicine. For that, I'm going to make part two. And this is how I came down to medicine. And I want to also, tell you the drawbacks of medicine, because medicine is a very good branch. It is a very it's a diagnostic branch. So every patient is a puzzle. Every patient makes you learn something new. Medicine is vast. There's so much to learn. Like it's perfect for people who are bookworms, things like that. But again, like medicine, the earning is not as much as any kind of surgeon would make at their peak. So you need to invest on time, you need to work on side hustles, you need to develop your personality, and you need to upskill yourself continuously. There's a lot of guidelines that keep coming. You need to do SS again in these days. Like you can't survive without SS. And there's a lot of things in picture right now with respect to medicine. Plus, at this rank, I would not get medicine in a very good institute or something like that, because Delhi institutes literally go in top 100. But I would get one of the best institutes anyway. So all of that aside, like my biggest problem with medicine is the money, but I am okay with compromising on money for job satisfaction and overall, being useful to the society. Because after a certain point of time, like money is just status and things like that. But I really want to be useful to the society. I've said this multiple times. I don't know, like when I watch this video 20, 30 years down the line, what I'll say, what I'll feel. But this is how I feel right now. And in part two, I'll talk about how I picked my college and what research I did, because I traveled all across India, spoke to a lot of people, and this is, a a dedicated video that is coming up next. So see you guys in the next one. Subscribe if you've not.